We have always advocated for clinical ADHD treatment on this show, and though I haven't experienced it myself, I've heard many, many good things about ADHD coaching as well. And I wondered what the differences are between the two approaches, whether they're meant to work together or not. And our guest today is going to help us with that because he's not just an ADHD coach, he's actually an RN and a nurse coach as well. I'm Aaron.
I'm Cass.
And this is Fuck the Plan, the ADHD Project podcast. So today we have a special guest with us, Seth Rotman of Clarify Wellness. He's an RN, board-certified nurse coach, and he also happens to be from my home area. I grew up in South Jersey, and he's right across the Delaware River in Philadelphia. So Seth, say hi.
Hi, it's nice to meet everyone.
You too, absolutely. And before we get to our serious topic, I want to start with something lighthearted. I have to point out that I have my Wawa mug today. And if there's one thing that I'm a big advocate for other than ADHD, it's Wawa expanding here to New England. And
Is that actually happening?
No, I'm an advocate for it. I want them to put Cumberland Farms out of fucking business, okay? Cass, have you ever been to a Wawa?
I have, and you know what? Just in your honor, when we drive down to Maryland over the weekend, I will stop at a Wawa for you.
And I will
send you a photo.
I was going to ask what everybody's favorite thing from Wawa is, so I'll start with mine because if you happen to bring some up, I'll be forever grateful. But the big half-gallon jugs of the lemon iced tea is like the best iced tea in the world, and they're like $3.
That's something that could hold throughout our trip and make it back safely.
What's your favorite Wawa item if you have one?
I don't have one because I've only been there once. And it was when the band was on tour, we stopped there once.
You have to go. It's the first, second, third, and last thing I do every time I go back home to Jersey to visit my family.
I'm a Buc-ee's girl.
Oh, Buc-ee's is good. Seth, what is your favorite Wawa item if you have one?
I mean, my go-to if I'm stopping in the morning is the hazelnut coffee with hazelnut creamer. But
oh yeah,
lunch items, turkey hoagie with I'm the weird one. It's a turkey hoagie with pickles and spinach on it.
That's right. You guys call them hoagies.
Well, that's because that's what it's called, Cass. But no, I mean, I think that doesn't sound too weird to me. Turkey with pickles and spinach. That sounds pretty good. Maybe we can get Wawa to sponsor the show. Wawa, give me $10 or something. I'll give you a shout out on the show. I just want to be able to put the logo on the podcast page that we're sponsored. But there is somewhat of a point to all of this, and it's that it does seem like there's a little bit of something for everyone at Wawa. And that's my cheesy cornball transition to talking about ADHD coaching versus clinical treatment, because what I find, at least through my own experience, is that there really is something for everyone when it comes to how we decide to treat our ADHD. So I wanted to open this up with a question for Seth. So Seth, let's say that someone has just learned that they have ADHD and they're going to kind of look into treatment for the first time. Tell us about, kind of what the options are for like clinical treatment, ADHD coaching, just a little bit about what's out there for possible ways that somebody could get help.
There are so many ways to get help. So this is actually one of the most overwhelming parts of getting that ADHD diagnosis is, what do you do now? So, right. And this is where all roads open up. So it's a great question. And there are so many possibilities. You can go the purely clinical route where you go to a psychiatrist and you go the medication route. Maybe you go to a therapist and you work through maybe all the things that clicked about your life before you had the diagnosis, and now you need to work through that part of it before you can move forward with things. Or potentially you just want to break the isolation that you've been feeling because you felt so overwhelmed by everything that you had been feeling from the symptoms. You felt like you were totally alone, but now you realize you actually have a community and you want to find that community. So there are resources like groups like CHAD out there where you can actually connect with other folks directly, learn more, do more that way. Or you can be more future oriented and go the coaching route, which is what I offer to my clients, where it's really digging into understanding yourself, understanding the ADHD, but then focusing on those future goals of how do you move forward with it.
And that makes a lot of sense. Like, I never really thought about it that way, like kind of thinking about the past and how we got here and then like the other side thinking about the future and like where do we go from here. What's been your experience with like your treatment, Cass? Like I know you have other things going on as well. So are you mostly like therapy, psychiatry side of things? Like, what have you focused on?
Yeah, I go to therapy, but I'm honestly, that's more for the bipolar disorder.
Right.
And I'm on medication.
Yeah.
I'm on Adderall, which is, always a treat to try and get through insurance.
Same with my man.
But that's about it. Honestly, I'd never even heard of ADHD coaching until you were telling me about it when we were talking about this episode.
Yeah. So I think that's a good place to start, actually, because, I think a lot of people aren't really aware of like what it is and what it means. So like, Seth, I would love to hear like a little bit about, what you focus on when you have someone who's a client, like what you focus on in your coaching. And, if you want to compare it to what you focus on in like your clinical side of your profession, that would be great.
Absolutely. And to be clear, I'm not saying any one of these things is one and done. Like I'm talking to you right now with the ADHD trifecta going on. I'm caffeinated, medicated, and got a terrible night's sleep. So this is
should be a shirt.
Yeah, it should.
This is, going strong on all of it. So, I'm coming at it personally from the psychiatry side, the self-medication side, and also all of the skill sets that, I walk the walk and talk the talk. As far as, what I am bringing with the coaching with my clients, this is a big answer. So I'm going to break it down in a couple different ways.
That's good.
There's the nurse coaching side of it. And then there is the certified ADHD service provider part of it. So as a nurse coach, there is everything that comes with being a nurse. So there's the evidence-based practice. There is all of the education getting into diet, education, deep dives into
kind of like a holistic
the full
type of approach.
Exactly, the full holistic approach. And most wellness coaches, if you talk to them, they'll talk about the 8 dimensions of wellness, which I'm not going to bother getting into all of them, but basically it's if you think about yourself in like what are the different things that make up my life, like I have a job, I educated myself, I worry about making money, like those are different areas of like wellness. And
with like the major things that we focus on in our lives, right? Like we have to deal with our like physical health. We have to deal with our, security and where we live, and our solving the problem of poverty with, some sort of employment or money, that kind of thing. That makes sense.
Right. And traditionally, like if you look up the 8 dimensions of wellness, that model is completely segmented. Everything is separated out into its own individual area. And honestly, for me, that drove me up a wall, because you can't only focus on one thing and not have it affect every other part of your life. The whole idea,
it's true.
The whole idea with changing something in your life is that it changes your life, because we are a whole. So you change one thing, it changes everything. So I didn't reinvent the wheel. I just changed how the wheel looked. So I use
that makes sense.
Yeah. I use what I call the 8 brocade of holistic wellness. Basically taking all of those 8 dimensions, but making it into a giant Venn diagram so that you can think of it where everything affects everything as you move forward.
Yeah, I get that for sure. Cause like a lot of times you do want to deal with like just one thing, but like if my financial situation were to change, that would obviously affect like my relationships, that would affect my living situation. Like it makes more sense to look at things all together. And so like, that wellness coaching side where it's all separated, is that like, sort of on the traditional coaching end, and like, ADHD coaching is like evolving a little bit. And is that like kind of what you're working at?
It all kind of gels together, because like I said, everything affects everything. When you start building the skills for ADHD, it's going to impact your relationships. It's going to impact your job. It's going to impact how you learn, how you're going to achieve. And that impacts your personal goals and what you realize you can actually achieve. It lets you realize, oh, I can do more than I realized. I can dream bigger. I can be happier. And so it just keeps going in this cycle. So instead of focusing on just one thing and locking in, I really encourage my clients to roll with me a little bit more and be a little more fluid. It's like, as things come up, let them come up. Don't fight it. We'll just let it happen, because things are going to change. The process that I work with as far as the ADHD coaching, I really give 2 clear paths to folks. And you can kind of tell that even for me with my own ADHD, I didn't give a straight line answer on this.
That tracks.
But
this guy gets it.
Yeah. But number one, I don't necessarily take a direct approach to being like, we are going to focus on your ADHD, because I'm not diagnosing. As a nurse, I'm not diagnosing. I'm helping you manage your ADHD, and there's no cure. We're not curing your ADHD. We're helping you manage it. We're giving you the skills. We're giving you the self-understanding. So number one, I have an 8-week course that I've created that that is for the folks that, like we talked about at the top, where you just got that diagnosis and you're at that what now phase. Like, you don't know who you are again. You don't know what skills you need. You don't know how to manage this. This is everything that I have gotten from my own life with the support that I've gotten, because I was diagnosed young. I was diagnosed when I was like 7 years old in the early 90s. And I was lucky. I had parents who were not only incredibly supportive, but are both psychologists and don't actually bring their work home. So they did it enough to support me, but not ruin me.
Right. So that's a tough line to walk.
Yeah, it is. But they did it well, and I give them full credit for that. They were incredibly supportive. They made sure that I got all the resources that were possible. Especially, they fought every fight possible through the public school system. And ultimately, I still fell through the cracks in public school, and I ended up in a private school for kids with learning disabilities, which was great, because then I got even more skills and a deeper understanding of how to be supported, how to understand myself, how to focus on the strengths that you have, and how to downplay weaknesses, and really go through that whole metacognition process. So I've taken all of that, combined that with my clinical background, my clinical research, as well as my martial arts background of meditation and mindfulness, and as a meditation instructor, mashed all of that together and brought it down to just the essentials in this 8-week course for, like, how do you get down to the essentials to understand yourself, do the hard work, basically make it painful up front so that it takes the pain out of the learning curve on the tail end.
Right.
And
so you find yourself in somewhat of a unique position, because basically as soon as ADHD was starting to be a thing people were talking about, you received that diagnosis. You know, you've had decades learning about it and learning how to apply it. But so many people are, now being diagnosed in their late 20s and their 30s and their 40s. And what do you find for people like that? What do you find the biggest adjustment is in their line of thinking to try and cope with it?
There are 2 lines of thought that are, I think, really difficult that I see. One is medication resistance, because people don't want to take medication. And I get that. I was that way, especially when I was younger. Like, you don't want to see yourself as different. And the idea that you have to take a pill to feel differently, to function differently, it's a really difficult mindset shift.
Yeah. I see that a lot, and I've felt that too, and a lot of feedback I get from people just through social media has to do with that. And I always liken it to like, well, if you went to the doctor and they said you had high blood pressure and you needed to take, Lipitor or whatever it is, people would sign right up for that. And they're like, yeah, sure thing, I'll take blood pressure medication. But when it comes to making your brain work properly, there's this such a stigma about it that people don't want to do it.
Yeah, they'd rather something be wrong with their body than with their mind.
And the truth is, mental health is health. Your brain is part of you. It's part of your body. It's no different than your heart, your lungs, your gut. No different.
Yeah.
And
that makes a lot of sense.
Yeah.
And the second line of thinking, you said?
The second line of thinking is that people get really stuck on this idea that, okay, now I have a diagnosis. Well, it branches in two ways. Now I have a diagnosis, and that becomes my sword and shield. Or now I have a diagnosis, so I have to fix this on my own. So either way, that is really detrimental. That's really detrimental thinking in either direction. Either you are embracing the fact that you have a diagnosis, but you're inflicting yourself on other people now, which...
Yeah, it's like an excuse, right?
Yeah. It becomes...
People say like, oh, well, I'm so silly in ADHD. I'm sorry that I, ran over your dog. It's like, no, dude, you got to pay attention still. It's not an excuse.
Exactly. And I mean, it goes even deeper than that, because people use the excuse in their relationships, or it's like, oh, well, I can't do the dishes. I have ADHD. That's your responsibility now.
Rather than finding a way to do it. And look, I joke all the time. I tell my wife, the reason that I do dishes every day is fueled by my desire to not have any dishes to do. Like, I hate having to do dishes, so I do them as often as possible, so that way there's never a big pile. So like, that's one side of looking at it. And then the other side is like, oh, well, somebody else just has to do the dishes. I'm sorry. Like, one is figuring out a way to work, and the other one is figuring out an excuse.
And like, me and my wife had to come to an understanding, because she and I both have ADHD, but they conflict. Hers demands order and cleanliness and everything to be pristine. My ADHD, the more chaotic things are inside my head, the more chaotic my brain wants things to be around me. So if there is a mess around me, it doesn't register as being a mess. And that led to a lot of fights early on. And so we've had to have a lot of conversations, and they weren't easy early on, but it meant creating new systems. It meant coming to a lot of different understandings. And it is easier because both of us have ADHD, that we understand that both of us have limitations. When it's a relationship where only one partner has ADHD and the other partner can't understand what it's like to be neurodivergent, statistically 50% of those relationships fail, because it's so much more difficult to create that support, to have that level of understanding. So
right. And it sounds like, I mean, like, it's so far from what you've described, a lot of what you do with coaching is like kind of helping people think about these things in the right context. And like, I joke, with my wife and I, like, one of us is an overthinker and the other's the underthinker. Like, I don't think enough. She thinks too much sometimes. And like, that was something we had to figure out. And like, I could see how having someone with experience to like help you through that situation would be beneficial. Like, is that kind of, what you do a little bit when it comes to the coaching side of things?
That's a big part of it. So part of it is everyone does better with an accountability buddy. There is nothing, which ties into that whole thinking of like, well, I need to do this on my own.
Right.
You can't do it on your own, not because you can't, but because we're not wired that way.
Right.
If everyone could just read a book, read a blog post, and just internalize everything, then we wouldn't need coaches. We wouldn't need therapists. We wouldn't need doctors, because we could all just read something, snap our fingers, and take care of it ourselves, which would be great.
That's not exactly how it works.
No, it's not how it works. And as much as our egos want to say that we can't. So having that outside accountability, having that third party accountability is so important, because now there's someone checking on you. Now there's someone just being that person who's like, hey, what's going on? Why is this happening? Why isn't this happening? And the other part of it is being that person who is ensuring that there is accountability occurring. I'm not the one who is emotionally attached to the outcome, which is really important. This is why it can be really difficult if you ask a partner or someone who's a close friend or a family member to be like, hey, can you coach me through this? They can be too close, because now it's not someone who's coaching you, it's someone who's pushing you.
Right. It's a different dynamic to that relationship for sure.
It is, and it can become hurtful, and someone ends up feeling hurt. Either you end up feeling hurt because of how someone said something to you, or the person that you asked to keep you accountable ends up feeling hurt because of how you responded to them, which is why it can be so helpful to have a coach or a therapist who, if you explode on me as your coach, I'm not going to lose sleep over it, but I am going to hold your feet to the fire as to where that came from.
Right. And it's like you have the benefit of being able to look at it objectively and say, this is a business relationship in a way. You know what I mean? I'm here to do XYZ things, and I'm not here to take it personally.
Exactly. And, the relationship is can be more personal than it can be with a therapist, but it is different. It is different because it is in that very different container. And then there is the mindset work that I do, which is also that piece of it where it's digging into what's holding you back, what level of understanding do you need, understanding where your strengths are, where your weaknesses are, leaning into what you can, developing the skills to work around what you need to work around. There is so much mindset work that goes into this beyond just the actual skills and tools that it can feel overwhelming, which again, it makes it really important to have someone who can kind of be your Sherpa to guide you through that process. And again, hold you accountable to push through the bumpy parts. Right.
And that makes a lot of sense to me too. Cause I've heard it said, and I think it is definitely important to acknowledge that we're not, when it comes to figuring out how to manage your ADHD, you have to stop looking at yourself as a broken neurotypical and make yourself just be forced into that specific mindset and path, because you're not going to think like a neurotypical person does. But figuring out how your brain works and how you can manage it, learning the rules so you can know how to play the game, has got to be a big part of how you can move forward. So I'm curious as to some of the along the same lines of the sort of mindset things. What are some of these things that you find people struggle with often that there's maybe just not thinking about it the right way, or they're trying to force themselves into that neurotypical box, but shouldn't really be doing that?
I mean, the number one thing is thinking that there is a box. And the truth is there isn't one. There is no one way to do things. There is no single path. There's no quote unquote right way to do something. Just because someone who follows a traditional path, maybe goes straight through high school, goes 4 years through college, and goes straight into a job, doesn't mean that is the right way to do things. I mean, I didn't even do it that way.
That was literally the topic of the last episode we recorded. That's why we're looking at each other
Cass and I are chuckling to ourselves because not everybody knows, we record 2-3 episodes at a time. So the last episode was not out when we sat down and recorded this, and Seth just said pretty much word for word what Cass I spent 45 minutes talking about, which is there's no single way to do everything. Everybody has to figure out what works for them. And so like I'm curious as to like some of the common things that like people think needs to be done a certain way. Like college and school is like one big one. We talked about marriage. We talked about whether or not buying a house works for you, or college. Like, tell me some of the things that you find that people are dealing with, feeling like they have to do a specific thing, but not actually realizing that there's so many other options out there.
I mean, other things that tend to come up are, staying in a relationship that's not working. Which,
that's a good one.
I mean, if you want to work on a relationship, I'm not going to tell you not to, but if it is a relationship that's not working and it is actively harming you, there is the question of what are you getting out of it, and
right?
Why are you staying? And
yeah.
What do you want to actually get out of this, and what do you want to move towards? There is also the question of a lot for female clients that I've worked with. It's, wanting to have a baby, or is having a baby reasonable, or
right.
Or there's the guilt of not wanting to have a baby,
and like feeling pressured to do it.
I feel, but honestly, there's no single path. There's no right way, or basically any single decision, or even in a job. Now that the job market looks completely different than it did even 10 years ago, the fact that people now realize that they can stay in a position that they feel comfortable in and just do that, and there's not necessarily a reason to climb the corporate ladder.
Yeah, like, I think people don't always realize that a lot too. Like, you got to figure out what you're getting out of it and what the benefit is, and like whether or not it's worth it for you. Like, are you doing it just to do because you think it's right to climb the corporate ladder, or are you doing it because that's what you really want? Because like I found after getting up to like management level positions that it wasn't really what I wanted in my career. And it's tough, like thinking that you have to do that, but then not, feeling satisfied with the result.
Exactly. And this comes back to a big piece of what I work on with folks, which I tend to not put it out there right away because it makes people a little gun shy, but talking about core values,
mm-hmm.
What are the things that absolutely influence your everyday decisions? What do you hold absolutely true? And what are you unyielding on? Because if you can identify those things, then you know your why. And if you know your why, then you can start figuring out where you want to go.
Right.
And it's easy to get.
And
go ahead.
No, I'm sorry. I was just going to say, and like figuring out why you're doing something and then doing it just makes it sounds so ludicrously obvious when you say it out loud like that. But we so many times are taught to do something and then ask questions later,
Yeah, and I think that kind of what you were talking about, you climb that corporate ladder, you do the quote unquote right thing, and then you wonder why you're not satisfied. I think there's a very particular type of depression that goes along with that.
Oh, yeah.
I'm doing everything right. I am successful by society standards. Why am I so miserable? And I think that adds a new layer of pressure onto the pressure that already existed. Yeah. That, you gotta, even if society deems you at a lower rung, you need to do something that you genuinely want to do, because the reason you feel miserable is that you just don't care.
Yeah. And like I've been in that position before, and it's a tough thing to realize, especially when you have no context for it. Like you've never felt that way before. You don't know exactly what you're going through. So I can certainly see the benefit of having someone who not only, has dealt with that with a lot of other, clients, but also has seen the clinical and the nursing side of it to see like, all right, well, these are your treatment options for it. And it includes so many of these things. So it seems like it would be just valuable to have even just that other voice of reason in your life telling you these things. Because I don't think like, correct me if I'm wrong, Seth, but a lot of, I'm guessing your clients don't come in to, working with you knowing exactly what they want to get out of things, right? Like, is that something that you kind of help them with?
Oh, no one comes to me knowing exactly what they want, other than like, I have issues with my ADHD. I want to do better, which is the
Right.
perfect starting point. As long as you know you want to move forward, and the only things that you need to know to be able to work with at least me as a coach are that you want to move forward and you're willing to do the hard work. That's it. If you're willing to start at that
Simple.
point, you are good to go, because we're going to get into it from there.
Yeah, that's awesome. And so that kind of brings me to one of the other things I wanted to talk about is like, how did you get started in this field as a coach? Like, what's your background? We heard a little bit about how you were diagnosed with ADHD,
Sure.
and then, it sounds like you've, had some different experience. Obviously, it takes, plenty of time and schooling to become an RN. So, like, what was your like professional journey like? How did you get started in, this field?
I did not intentionally get into nursing, which is actually kind of funny. I actually kind of fell backwards into nursing and then realized I loved it after the fact. I like I was talking about, did not take the traditional path. I took a gap year after high school. In that gap year, I actually did a semester with the National Outdoor Leadership School, and among other things in that gap year. But while I was on that semester, before they let you out in the field, you have to get certified in wilderness first aid. That training and certification, I absolutely fell in love with emergency medicine. So after I came back from the backcountry, I immediately went and got my EMT certification. I ran 911. I actually did go to college for a year as a film major, which is why I'm sitting here as a nurse coach now. The school I was at, I did a wonderful crash and burn, but they also dissolved the film program the semester that I started. So I just,
great.
Yeah, I just kind of floundered and just kind of figured it out for that year. Came back home, ran 911 some more. I was like, I don't want to be just a Band-Aid whacker. I want to do more. I want to be a paramedic now. Every medic that I worked with was like, do not become a paramedic. Like, it's a certification. Go to nursing school. If you still want to run on the truck, You can take the exam. You can still run on the truck, but go to nursing school. So I listened to them. I did. And within the first semester, I realized how much I really loved it. I mean, I hated nursing school. Nursing school is terrible, but I loved nursing. And, over a decade later, I have worked inpatient detox rehab, which was my first job. That gave me such a depth of compassion and understanding for mental health and addiction and just everything that people can go through. I've worked step down units for cardiac and stroke. I worked all over the hospital at one of the major trauma centers in Philadelphia, was bedside through the pandemic. I've worked in interventional radiology. And before I completely stepped away from the bedside, I was on a post-surgical unit in a cancer center. So I have just watched people all across the spectrum in all areas of healthcare. And I've also seen how healthcare really fails people.
Right.
So ultimately, I was looking for a way to not only help myself, because I was getting horribly burned out, and I did have PTSD from the pandemic as well, that I did get treated, but I was like, I can't keep doing this. And I originally thought becoming a nurse practitioner was going to be the way to go. But I got into an NP program. I went halfway through, went through my first clinical rotation, and the more the curtain got peeled back, the more I realized that it was actually worse. It was more of the same with more responsibility, less pay, and insurance coding. It was not what I wanted to be doing, especially with less time
Right.
with patients. So I ended up dropping out of that program and finding nurse coaching. I found a nurse coaching program. It was an extra 7 months of training to go through the training process and then to take the boards as a nurse coach. So to still be a nurse, to be trained as a holistic coach within nursing, and to be able to truly serve people in that meaningful way that I had been looking for. And then from there, I was able to really make it my own to, do it in the way that was meaningful for me to serve people in the ADHD space.
So do you still do like traditional nursing as well, or is this like your primary job?
I don't. I have completely burned the boats. This is what I do.
Congrats. That's awesome.
That's awesome. It's very cool.
Thank you.
We're always talking about, stories of trying to kind of step out and do something on your own, and how those of us with ADHD are fairly uniquely tailored to, this type of a profession where you're working with other people, you're, in charge of your own destiny, so to speak. You have your own, you're accountable to yourself. And I just think it's awesome. And so it's Clarify Wellness, if I'm not mistaken. We will, of course, be putting the link in the description here. And one thing that I wanted to hint on, because Cass, if you're looking at the timer, I started it very late, so we're almost out of time.
Okay.
But one thing that I did want to touch on is that Seth and I have talked a couple of times, and the ADHD Project has done one webinar so far, but we're looking to do another one coming up shortly. And thankfully, Seth has agreed to be one of our guest presenters for our webinar. So I'm going to leave the topic as a bit of a surprise. But I just wanted to give everybody a little bit of a heads up and a teaser as to what's coming down the line for us. So it's been great talking to you, Seth, and kind of having, the curtain peeled back a little bit for us as far as, what you do as a coach and how you work together. And
I do have one quick question that might
let's hear
be
it.
relevant to our listeners here. For the people that you treat, is it all local, or do you do virtual appointments as well?
I run a hybrid practice, so I see people locally and nationally and even internationally. I've seen patients from Canada even right now. And so there is no restriction on where I see anyone from. And the truth is, I know that we've talked a lot about it, but coaching truly is an experience. So I really do encourage anyone, if they have any more questions, to set up that free discovery call, because it is really that experience that helps understand, is this right for you?
Awesome.
That's awesome. And, we're letting the cat out of the bag a little bit here, but Seth and I are going to be doing like a coaching session for me and recording it. And we're going to try, if anybody is still curious what it is like, to try and get some more, info out there. And so you can see what it's actually like to have a coaching session. And I have no problem. I'm an open book. I put myself out there all the time. So I don't care airing my laundry out, not that I'll, be too crazy, but, I'm very much looking forward to that. So, if you're curious about where to go from here, there will be an update at some other point. We'll have it out on YouTube with sort of a straight up, video recording of what it's like to actually have a session with Seth. So, with that said, before we wrap up, was there anything else that you wanted to mention, Seth? This is your time for your shameless plug. If you need to, feel free, give us some self-promotion here, and then we'll shut the door on this one.
Just folks can find me on Facebook at Seth NCBC. I am on Instagram at Clarify Wellness LLC. Also, Seth Rotman on LinkedIn, and you can go to my website, clarifywellness.coach. I do also have one big program coming up for anyone who is in a leadership position or wants to really take their leadership to the next level. I have partnered with the National Outdoor Leadership School to offer a 7-day backpacking expedition in the southern Utah canyons coming up in April 2025, which is
That's awesome.
Yeah. So that is combining the NOLS leadership curriculum with my ADHD management curriculum for those 7 days.
That is awesome.
That's amazing.
Very cool to hear. I'm actually going to have to look into that myself. Right. That's very cool. All right. Well, thank you very much for being here with us, Seth. I'm Aaron.
I'm Cass.
And this has been Fuck the Plan, the ADHD Project podcast.